Let's talk more now about the president's health and COVID-19 treatment with emergency room physician Dr. Larry Burchett. Dr. Larry, thank you so much for being here. The president's personal doctor insists that the president is well enough to leave the hospital and return to the White House. Knowing what we know about the president's condition, would you have allowed him to leave the hospital?
Heather, I think the first thing to point out is that the average American would never have been admitted to the hospital in the first place. They've told us that initially the president's oxygen level dropped to 94 to 93%. Most people, if that's all that it is with COVID, are still okay to go home. Now, this is the president of the United States. They were worried with COVID, was he going to get a lot worse? And they wanted him not to be in the White House, but in a hospital. So that makes sense. But I don't know that I would have admitted an average person with his condition in the first place. Now, the weekend, he clearly got better. His symptoms of fever and cough, they got better. His oxygen level, if it was 93 and 94, I heard numbers like 96, 98. That's back to normal. He looks pretty good. It makes sense to me that he's being discharged today and going back to the White House where they can continue to monitor him. It's not like he's going to an average residence where there won't, at his disposal have all kinds of monitoring and medical capabilities. I think that's appropriate.
So, there are still a lot of questions, Dr. Larry, about, the president's illness, how serious or it may be or may not be. But from the information released so far, what might his treatment consist of over the next few days while he's there at the White House?
Well, they already initiated him on a course of three things. He got one dose of Regeneron, which is kind of an experimental medication. I've never seen a patient get that yet. That was one dose and done. They said that he's going to complete a course of two key medicines that we really give to all sick COVID patients, really sicker than him. We're talking need to be in the hospital on oxygen in the ICU. Trump was never really that sick. But those medicines include dexamethasone, which is a steroid, kind of like prednisone. So he'll finish a course of that, maybe 7 or 10 days. Some doctors stop it when patients no longer need oxygen. So it's unclear how much of that he's going to get. And then they said he is going to complete a 5-day course of remdesivir, the antiviral medicine. So those would be the two meds that he'll get, in addition to things like vitamin D and an aspirin and some of those other meds. And then they'll just keep an eye on him, measure his oxygen saturation, check his blood pressure and his vitals, check in with how he's feeling every day. Yeah.
Yeah. All right. Well, Dr. Larry, I'm sorry we have to end the conversation there, but thank you so much for coming on to talk with us about the president. Really appreciate it. Thank you.
Thanks, Heather.